But now, before that, Dr. Nighat is here to take us through all the latest health headlines.
Hey.
Doctor, good morning to you. We're talking about, what we're talking about?
The UK's ordered 35 million more doses of the Pfizer vaccine as it's preparing for booster shots. And I think some people are saying, well, when will this happen? Who will be eligible? Is it definitely going ahead?
So we are still waiting for more data. As GPs, we were told around June, July time that there would be possibly a booster vaccine. The recent data that's come out has shown that actually especially with the Pfizer vaccine, it could be that you're only getting immunity after one and the second dose for about 6 months. Where does that leave our vulnerable group patients? Because the whole idea is that we keep them protected and we're heading into the winter months. So the idea is that we're still waiting for more information from the JCVI. They've been doing some trials already and we're waiting for the data on that. And the JCVI should be making a decision about having the booster vaccine rolled out as well as the current vaccination program with the flu vaccine from September onwards. So it's just going to be one of those things, watch this space.
Yeah.
But the World Health Organization has already said, you know, try and make sure that you delay your first and second doses if you've already got lots of vaccines in your community, and try and give it to other other countries who haven't even started their vaccination program. So it's about vaccine distribution. There's a lot of ethics involved around that. But I do feel that if we are going to make sure that we don't have future lockdowns, that a booster vaccine is going to be required.
And I'm assuming that you shouldn't contact your GP. You will be contacted and be called
Yes.
for a booster.
Please don't contact us. This is something that's going to be rolled out nationally through the NHS vaccination programme scheme.
OK.
We're going to talk about diet pills online. If you turn on your mobile device or your computer, you're probably going to be inundated with this sort of thing. It pops up. But as to what actually goes into some of these pills is causing a lot of concern. Tell us more.
Well, this is nothing new. We've talked about this before and this morning. Just be very careful when you're buying diet pills, even if they say herbal on them, because herbal things do cause side effects. So one of the research that they found is online diet pills that have yohombine in them, which is a bark from West Africa. We as doctors, we've known about it because sometimes we use it in very controlled amount for sexual dysfunction. So it's great for sexual arousal. But actually there is some data to suggest that it helps with fat burning and metabolism. The problem is that the quantities are unregulated when they're in medicine. So synephrine is another one, which is a fat loss booster, fat burner, and also increases energy performance so you can exercise longer. But those medications have side effects, even though they might be branded as herbal. So such as increase your heart rate, they might actually cause kidney damage, maybe even liver problems because of the clearance that happens, risk of putting you at stroke, fatigue, anxiety. So just be really careful. And actually, my sort of advice as a doctor to my patients is just don't buy diet pills. There's a really good meta-analysis that says they don't work. And I'm a culprit of it myself. As a doctor, and historically, I have brought diet pills to help because you do buy into the fact that they think that they'll work, but they don't work. Calorie control, exercise, and just doing the usual stuff, the normal stuff is the bits that are going to work for you.
OK, let's talk about women and drinking. The number of women drinking, and this is at high-risk drinking, they're calling it, that rose by 55% during the first lockdown. And also the number of young adults smoking rose by a quarter, not numbers that you'll be happy to hear about.
No, and stuff that I've seen in general practice. I think there's no denying the rise in mental health and the impact that has had on drinking, eating, lack of exercise because we've had lockdowns as well, and then smoking and even illicit drug use, which some of my patients have resorted to. And those are the signs, the fact that the pandemic has really affected a lot of people. But it's always amazes me how when it's women that are drinking, that always hits the headlines far more quickly than men who are drinking. But actually, alcohol consumption has increased in men as well. There's great resources out there. So you can self-refer to the IAP services, which are psychological services if you are suffering with your mental health without even going to the GP. You can do that online if you go to the NHS website. There's also apps by the NHS, the drink-free days, so you can calculate how much that you're drinking and just have maybe 1 or 2 days in the week that you're drink-free. And Every Mind Matters. There are so much resources out there. So Every Mind Matters gives you lots of great hints and tips on how to manage your anxiety. And I always point my patients to that as well. But the great thing is from this article as well, and this is something that I'm seeing, that as we're easing out of lockdown and people are resuming some sort of normality, whatever normal is for them now, that we are seeing a 99% successful rate in actually cutting down drinking, cutting down alcohol. So that gives me reassurance that I think that in time, as we do find new normal, that people will get back to the rhythm of life and start actually decreasing on some of those bad habits that might have creeped in, whatever they are.
Except smoking is going up, and the number of young adults smoking is up by 25%. That's bucking the trend, isn't it?
That is bucking the trend. But again, this is something that we see. It swings and roundabouts, Eammon. With younger people, we are seeing that actually they've had lots more problems in regards to education, job losses, more impact on mental health. And so these sort of bad behaviours are going to creep in. And vaping has come in, and we are still looking at the effects of vaping as well. So when you look at smoking, just be careful. What do they mean by smoking? Is it cigarette smoking? Is it marijuana? I mean, what are they actually smoking? This doesn't really quantify that.
OK, it's a headline in the Times today. Drinking tea sharpens the ability to solve puzzles.
Well, as a tea drinker, this makes me very happy because also tea drinkers, and I don't know if you guys are tea drinkers, Eammon or Ruth, but we're meant to be more smarter, more elegant, sophisticated, and just all round great people. So I will definitely say I attribute to all of those as a tea drinker.
But what is it in tea that's supposed to make us smarter?
Well, do you know what? This study is negligible. It shows what they did was they had 100 participants. They got a group of people to drink tea, a group of people to drink water, and a group of people not to drink anything. And then they did a word puzzles and things. And they found that the ones that were drinking tea marginally scored a little bit more. The theory is that there's caffeine and theanine in there, which allows us to have a bit of a boost of motivation. That's why we have caffeine in the morning, to give us that, the get up and go.
When, of course, you drink all that tea and water, it leads to you wanting to wee. And there is also a report today on how to wee correctly. There's a right way and a wrong way.
So a dear colleague of mine, actually, Dr. Sheree Dutta, who's a consultant gynecologist and obstetrician, had said that women should be double voiding. So that means that when you want to have a wee, get onto the toilet, make yourself nice and relaxed, and so that you then pee, but without actually straining or pushing, etc. Then get up, have a little walk around, and then sit down to completely empty your bladder. Because if you have complete emptying bladder, then the risk of urinary tract infections decreases. This is fine. This is all okay. But as a women's health expert GP, I find things like this, if I'm completely honest, slightly demeaning for women who suffer from urinary tract infections. Urinary tract infections are horrific and horrendous, and they really impact those that suffer from them, particularly those with chronic urinary tract infections. And to say to them, well, you're not peeing right, is actually just, I don't feel it's going to be all that practical. What we need is better research in understanding why women get more urinary tract infection, better understanding about vaginal atrophy. So vaginal atrophy is sometimes termed as vaginal dryness, and it's seen that only older women get it. But I know that the balance of estrogen and progesterone when women go through the changes of perimenopause and menopause can actually impact the way that the vaginal flora reacts. So your risk of getting urinary tract infections are actually worsening. So a woman in her 40s who is going through the change and comes and tells you that she's got irritation, itching down below, difficulty having sex, difficulty having smears, and it's sore, and she's getting recurrent urinary tract infection, do not just assume it's a urinary tract infection. Treat her for vaginal atrophy and give her vaginal estrogen. Vaginal estrogen is safe. It does not cause breast cancer, it does not cause clots, and it's only topical estrogen, and it should be applied and used lifelong by all women. And this is something that we should be educating women more and more about, not telling them how to pee, for goodness sake.
OK. Well, thank you very much, Dr. Nighat. Thank you for that and all those other stories, and we'll see you again very soon. Thank you.
Thank you.
Just before we go to the break, the floor below us here is full of little worker bees who